In my opinion, the lasting panacea to the persistent regimen of disputes between the government and the healthcare-based trade unions is the formation of a health service commission. Such a commission, with the finger on the pulse on emerging issues and short turnaround time, can cure the situation and bring greater sanity to our healthcare sector. To address this, I call upon all stakeholders in the health sector to robustly start an engagement with the Departmental Committee on Health in the National Assembly and their Senate counterpart Committee on Health, and probably move this matter from a conversation and have the commission established through an amendment to the Constitution before the end of the current 12th Parliament.
I will want to work with the Speaker of Parliament and the Senate and Parliament members so that we can ensure that we have good legislation enacted where it's in the best interest in terms of addressing the many challenges we face in health, including the human resource for health, where he's clearly pointed out that there is need to have a health service commission formed so that we can address these perennial challenges that our counties are facing in terms of management of these rare precious resource, which are the specialized and the doctors and the other healthcare workers. We are prepared as a country and as KMA, and I know working closely with the Ministry of Health, we'll be able to respond and we cannot be overrun with this infection. I think it's just the issue of ensuring that all the counties in the Ailing region have the capacity and the necessary support to handle this particular pandemic. And of course, we urge the public, including politicians, to ensure that we all follow the Ministry of Health guidelines and protocols in terms of social distancing, public gathering, and wearing a mask so that we can protect ourselves. The most important thing, and I'm happy that it was allocated during this year's budget, is the government to move with speed, procure vaccines, not only for healthcare workers, but for all Kenyans, so that we can be quickly vaccinated and get back to our normal lives. Because the longer we stay unvaccinated, the cost of this pandemic might be very hard for us as a country to recover from.
Is to facilitate accurate reporting on matters of health. So the idea is that health matters, while they affect every Kenyan, they are very technical. Sometimes journalists are not able to pick the real issues. So by getting this MOU, it means that we will have collaboration between doctors and journalists at different levels, national level and at county and regional levels, that journalists who need information on matters of health, the broadest spectrum of health, can access doctors at short notice and be able to get the information. And when they want interviews with doctors on the radio stations, TV stations and all that, we can have medics available. The whole idea is to ensure that Kenyans receive accurate information and journalists are not left to second guess vocabularies and medical terms they do not understand.